Hi guys. So we've been looking at different tests which could be done for congenital adrenal hyperplasia mostly. Alright, this test could be used for other things too. So one of these tests we got to see that it is what is known as what? 17 hydroxylase what? Progesterone test. Alright. So 17, okay, it's hydroxy progesterone, right? Not hydroxylase. Hydroxy progesterone. So it's just a test where you're doing it to measure the levels of what? 17 hydroxy progesterone in your blood. That's 17 OHP, right? Different ways you can call it. Now, the hormone is produced by the what? Adrenal glands and is a precursor in the synthesis of what? Cortisol. You understand? Cortisol, like the whole process has to go through 17 hydroxy progesterone, right? Before the formations of all those cortisols. So you are trying to measure their levels in the body. When we are talking about interpretation of results, you get to appreciate why we are measuring it, right? But however, just a briefing, if you see elevated levels of this 17 hydroxyprogesterone in the body, it indicates that there's what congenital adrenal hyperplasia, right? Which is a group of genetic disorders affecting the adrenal gland function. So purpose of this test is to diagnose congenital adrenal hyperplasia. First of all, especially in newborn, to screen, that's to basically help you to dictate congenital adrenal hyperplasia early. So it will also help you, the test, doing this test will also help you to monitor treatment. All right. So it will monitor how the person is responding to treatment. You understand? So monitor treatment. So for individuals diagnosed with congenital adrenal hyperplasia, you want to monitor their hormone levels and see how they are responding to treatment to see if you are adjusting it to add the treatment or remove the treatment. You understand? So procedure is a preparation. No special preparation is needed, but you may need to ask the patient to fast for a few hours, maybe overnight. You understand? Maybe overnight. So they will basically not eat right before coming. Then blood samples. You collect blood samples from the veins, usually in the arm, right? Then follow-up tests or additional tests may be conducted just to confirm the diagnosis before you initiate the test, right? All right. So normal levels actually vary. That's another thing. It varies based on age, based on sex, based on specific laboratory standards. And the elevated levels, if you see elevated levels there, it indicates that there's congenital adrenal hyperplasia or some adrenal gland disorders like that. Okay. So this is it for what? 17 hydroxyprogesterone test or the 17 OHP test.